All right, thank you. So again, thank you again, Dr. Kani, for introducing me with the kind words. So again, my name is Dennis. Again, as like Dr. Kani mentions, I'm one of the IMU alumni from Dietetic Nutrition programs, and I was from class 2020, which is cohort DN116. So I'd like to begin just by saying that I'm honored and happy to share my professional journey as a dietitian and as well as an IMU alumni. And just to add one of my aspect as well to my profile, I'm actually Indonesian. I'm from Indonesia, but currently working in the United States. So, so I'd like to start my sharing sessions by just gonna give you a little bit brief timeline about my professional journey as a dietitian. So of course, my professional journey began with IMU, starting with my first bachelor degree, which is back in 2016. So back then, I think the cohort or the class was kind of big. It was about like 45 to 50 students, so it's kind of big. And then I spent about 3 years learning about their curriculums in dietetic with nutrition, that alongside with research projects. And in that final year, I spent about one year spending on dietetic practicum. So dietetic practicum in IMU is basically a supervised real life practice as a dietitian. We were put into different settings like community, food service, as well as clinical settings. And finally, back in 2020, I was able to graduate with my bachelor degree in dietetic with nutrition. And that was back in during the pandemic as well. So I didn't get a chance to celebrate my graduation ceremony. So I went straight back to Indonesia. I went back to my hometown, which is actually Bandung, and I started with my first career as an inpatient dietitian. So I work during the early 2021. I work as one of hospital here in Bandung. My role here is pretty much covering the inpatient units. So among hospitalized patients, I handle their meal sessions, making sure the patient receiving a correct diet order, perform receiving referrals from doctors to make sure that I can conduct bedside consultations as well as discharge planning to manage the patient's diet as well. But I think the only thing that's unique about this experience was because it was during the pandemic. So we were actually short staffed, and then we were having like an increment of patients with COVID-19. So I was given the opportunity to kind of handle or covering units among patients with COVID-19, which is, to be honest, is not an easy job because that was my first career. I didn't have the exposure to handle like COVID-19 cases. But I think that's the beauty of like learning is just like when the opportunity comes in, you just kind of have to jump in and then just work way through it. And I was glad that I was receiving like a lot of support as well from my fellow dietitians there, and then was able to kind of learn more new stuff, especially for management of COVID-19 integrated with nutrition. And then moving forward, back in the quarter end of 2021, I decided to pursue my master degree program with Rutgers University in New Jersey, United States. I pursued a master program in clinical nutrition. And then for those who don't know that IMU and Rutgers has this academic collaborative program or like a partnership in which that IMU dietetic with nutrition programs or IMU with dietetic nutrition graduates can have like a direct pathway to apply for the master program. And in my experience, the transition was smooth and I was able to apply directly to the program without any issue at all. So yeah, the master program itself, I spent about like 18 months to complete. This also involved another research project as well as another clinical training. So in this intensive clinical training is pretty much the same or like the one I did back in when I was in with IMU as well. But the only thing the different is here is that I mainly they focus on the clinical aspect as well, or in the clinical settings, which is the healthcare services. So I spent about 18 months, and also the aim for this clinical training was to obtain enough credit hours. I think that was about like 1,200 credit hours for me to eligible for sit for the examinations, which is the registered dietitian examinations. And I was fortunate enough to be able to complete that hours when I was graduated with my master program. So yeah, in early 2023, I graduated with my master degree in clinical nutrition. I was eligible to sit for the exam, and I obtained my first registration license as a dietitian in the United States to practice as a dietitian. And then moving forward, I think this opportunity comes in, which is University Hospital. So a little bit background about University Hospital. So the University Hospital is one of the hospital that was affiliated with Rutgers University. That was also the hospital that I was trained for during my intensive clinical training. And then I was offered by one of the clinical nurse manager that they were actually opening up or adding a new clinics or centers, which is their bariatric and weight management centers. This is their first clinics for bariatric patients or populations. So I was offered the opportunity to fulfill the positions or the roles of a dietitians there as a bariatric surgery dietitians. And I took that opportunity, and I've been working with them since then. Um, and I think aside from that, I also have a strong passion as well with internal nutrition supports, which is why I recently sit for another exams to just receive my another certification, which is the board certification in nutrition support clinician. So that's pretty much covers the timeline of my professional journey up to this date. But I would like to share more about the roles or the journey of my career as a bariatric surgery dietitian, and to share more a bit like what's day-to-day basis looks like as a bariatric surgery dietitian. Um, so yeah, as I mentioned before, the university hospital that was just in 2023 was just recently opening up their bariatric centers and weight management centers. And then back then, I was the only dietitians that was uh, covering the roles of the clinic. So to be honest, it was kind of like nerve-wracking for me because to be honest, because I didn't really have a lot of experience with back surgery, even like making a new project or new program, running new nutrition program that can match with the bariatric program as well. So I was kind of like nerve wracking, but again, I was fortunate enough that I received a lot of helps and support from my clinical nutrition manager, from the senior dietitian as well, which I was able to kind of develop the nutrition program that can be fitted into the bariatric program as well. And yeah, it was kind of like a fun journey as well. And then I think, and then just to give a little bit more context about bariatric surgery. So bariatric surgery is also known as a weight loss surgery or like a procedure. In United States, it has been quite very familiar procedures or managements for obesity. Because the rate of obesity in America has been rising quite exponentially as well. I think if I'm looking at the data like very recently, like almost more than 50% of the populations there was actually having obesity and also overweight as well, which is actually quite alarming. And that's why I think weight loss surgery or this bariatric surgery become more imminent or more effective tools to manage the epidemic of obesity as well. But again, just want to emphasize a little bit that this weight loss surgery is mainly just a supportive, effective tool. It is still like not a magic bullet. It doesn't really treat obesity like completely 100%. Nutritions in this case play a huge role because the key of this weight loss success is actually from nutritions. We help through making sure that the patient is receiving adequate nutrition to prevent any nutrition deficiency coming from complication of the surgery, but also help with making sure that the patient receive enough calories and also nutrition to reach that weight loss goal. Because the weight loss surgery only create a tool by actually altering the digestive tract, making sure that we don't that our digestive tract is to have lower capacity. But again, the one that's actually making it successful is actually from this nutrition, which is why dietitian role here is a very huge. Dietitian role covers from different aspect in this case coming from before the surgery, after the surgery, and as well in long-term phase. So pretty much that the only thing that I was told to my patients that by the end of this program, pretty much we're gonna be like friends and family because I'm gonna know you like pretty much like from like 20 visits or 30 visits as well, which is very very like comprehensive visits. And yeah, that's pretty much the background about the back surgery itself. And then I'm just gonna go through a little bit more about what is actually in different phases and what's my roles in it. So once the Batic program started, basically we always started with the Batic seminar, which is usually in the first week of the month. The goal of this Batic seminar basically is to gather participants, candidates that is actually are eligible meeting the criteria for the Batic surgery, and all the participants were able to meet the holistic team or the multidisciplinary team, which is involved the surgeon, advanced practice nurse, psychologist, myself, which is dietitians, other specialists as well, like cardiologists, pulmonologists, social worker, as well as program coordinator. All of them basically have important roles, and each of them has important roles for the patient's success. So that's why it's not always like a one-man team. But it's not always the surgeon, but of course involved with other healthcare teams as well. And then the pictures on the left corner here is me, myself, and one of my colleague as well. She is a advanced practice nurse, and we were actually at the back seminar, and we were explaining like the expectations of the surgery and what to be aware of and what's the complication of the surgery. So yeah, but at this seminar, pretty much I only cover like basic nutritions, like what needs to be done, how many visits that you need to be done with the nutrition with the dietitians as well, and also emphasize a little bit on that in these practice seminars or in this practice program, it requires continuous motivations and huge in terms of compliance and adherence for the success of the weight loss as well, or the success of the diabetes program as well. So I always emphasize that during these seminars that patients have some kind of expectations that nutrition still be the main medicines here after the bariatric surgery. So that's the bariatric seminars. So once they meet with all other clinicians as well, the program coordinators basically will actually assist the patients that want to proceed with the bariatric program to meet with each of the teams. So they will set up like follow-up schedules, the pre-assessments visits as well. And for myself, I usually set up a minimum of 3 visits, which is mandatory visits before the surgery. What I did in this setting is that first I will conduct a full nutrition assessment, and in this phase is actually a very important phase because we want to treat early for any nutrition-related problem, whether it's a inappropriate eating behavior, whether is it this patient having nutrition deficiencies. So we always order like perform a physical examinations. We perform a body composition examination analysis as well. We order nutrition-related lab values, particularly looking at vitamins and things. Just to throw in some fun facts that most of our patients that comes with obesity itself tends to have vitamin D deficiencies at the very early starts of this visit as well. So we have to treat that because if we don't treat that in early phase, that can become a complicated problems, especially right after the surgery. So that's why the full nutrition assessment here is very important. Aside from nutrition assessment itself, I also implement a medical nutrition therapy, which is a nutrition therapy for weight management, because it's also important for the patients to have at least a minimum of 5 to 10% weight loss from the initial weight before the surgery. And the goal of this weight loss to help to reduce the size of the liver, which can really help surgeons to perform the surgery better and also, of course, improve the outcome of the surgery. And of course, the visit itself is not always just a 3 visits. It can become like 5 visits, 7 visits, and involve like a lot of counseling methods here because we need to create like a healthy eating habit, and it's not easy, and it can kind of be done with just like 1 visit. So that's why using nutrition counseling is really helps for the patients to set up realistic, visible goals and helping them to actually move to making good choices about their diet as well. And yeah, and then when it's got closer to the bariatric surgery itself or the surgical procedure itself, I will introduce them to the post-bariatric diet so that they know what are the typical foods, the schedule of the meals, the texture of food they've been going through, and of course, patients love this very much. Is actually during the last visit of the dietitians before the surgery is to have like the taste trial on the full liquid diet. So this taste trial on the full liquid diet pretty much the goal here is to allow patients to have some kind of to choose their preference of on their which type of nutrition supplement drink that they want to choose, because they have to go through a very long-term liquid diet, because they have to go through 2 weeks before the surgery on liquid diet, and 2 weeks after the surgery they have to go on a liquid diet as well. So that's why, and then there are a lot of tons of different protein shakes or just supplements drink that they can choose from. But again, not all of people tend to prefer one from the other. That's why I let them to choose or have a taste trial so that they can know which of this drink they are preferred to basically to stick on to as well. Um, and then finally, before the surgery, this is that we will have another clinical team meetings. This meeting basically is without the patients. It's basically just a meeting between all the clinicians as well, where we will discuss all the patients on the list of the bariatric to be selected for the next step as well. So the picture here on the left side is our full team on our bariatric clinic. It's not always this big a group, because sometimes it's just mainly just about 8 to 10 clinicians that are directly involved with the patient. So this is just like a group pictures whereby we have a full team as well. But yeah, in this case, basically we'll have a group panel discussions. We will go through one by one from the list on the patients that completed with the bariatric program and that was ready to schedule for the surgery, and we will have an open case review. So meaning that each of the clinicians will have the chance to present their opinions based on their assessments or on their consultation visits on what the patient's looks like, if the patient's evaluations can be proceed for surgery, or if the patients cannot be proceed for the surgery for certain reasons. So there are certain cases in which that I have to suggest that the patient should not be go for the surgery, because I found that the patients, when I test their motivation levels, I found that the patients tend to be not really motivated, and patient having very poor adherence and compliance to the nutrition plan, which I emphasize that it could be dangerous, especially post-bariatric surgery, in terms of compliance following the bariatric meal plan, which again can be harmful and again reduce patients' outcome and care outcome as well. So that's why we would suggested that we would extend the program itself and then delay the surgery itself until the patients have better tolerance or better compliance and motivations. And yeah, each clinicians will also again open up for discussions, and then I think the last part as well, I'll present some of the post-bariatric diet as well to use so that we are on the same page as well, and making sure that I reported that all the bariatric nutrition's supplements drink are ready and also are being given to the patient as well during the post surgery as well. So after this, pretty much is the operative phase. So during the post-operative phase, patients usually will be admitted to the hospital for day 1 to day 3 after the bariatric surgery. And I will definitely visit the patients during day 1. And the goal of day 1 is always interesting because we always have this feeding trial. Patient will be given, I'll prepare them a clear liquid diet. This clear liquid diet pretty much involves of bone broth or vegetable broth if the patient are vegetarian. Patients also be given decaffeinated tea or decaffeinated coffee, as well as sugar-free electrolyte drinks. And they will be given this tiny medicine cup. This tiny medicine cup is pretty much about 30 milliliters, and we advise the patients to really sip the drinks. And we will basically will sip the patient for about 30 minutes to making sure that the patient are able to tolerate these liquid diets. And they will be sipping like very slowly, pretty much. We will suggest that one medicine cup of this will be covering for every 15 minutes. So they should finish this one medicine cup for every 15 minutes. And the goal is always to finish within 64 of these in a day. And then by day 2, by day 3 as well, I will again revisit the patients, and given the patient with the post-bariatric diet instructions, I will order lab as well, particularly on electrolytes, to making sure that the patient is not dehydrated. And finally, this the day 3, which is actually the discharge plan. The discharge plan here is making sure that the patient are clear about what should be what are the foods, what are the meal plan that they should be doing right after being discharged from the hospital. This is also began testing the patient's knowledge, making sure the patients know who's actually the caregiver. So I perform like a very full education for the patients, and I'll advise the patient or schedule the patients for the follow-up visits. And the follow-up visit itself basically is quite comprehensive for the first two months. Patient have to come back every single week for the first 2 months, and finally after 2 months, if the patients are tolerating well, they should come back every once a month following after the 2 months of the surgery itself. And then, so it's a very like a long journey, like I mentioned earlier, basically from the nutrition visits before and also after itself as well. Even like after 1 year to 2 years as well, patient will still come visit me as well, to making sure that patients keep on track on their weight loss goal and making sure we prevent any nutrition deficiency and or correct nutrition deficiency as well, because nutrition deficiency can be quite a huge complications, especially with bariatric surgery. And then I also prepared this slide for those who are wondering how's the bariatric diet looks like. So if you see here, it comes with different stages. The first stage is always the clear fluid diet, like I mentioned just now. That's only basically for the first 2 days, and then once they're being discharged from the hospital, they will transition to this stage 2 diet, which is actually called as the full liquid diet. The full liquid diet, pretty much we are using a nutrition supplementation drink, which is called a protein shakes as well. This is very high in protein and very low in sugars as well. And patients will pretty much have to drink about three of these bottles in a day with adequate amount of water as well. And then after 2 weeks on this liquid diet, they can transition to a puree diet. Puree diet again, and then after they tolerating certain think about 2 weeks of on the puree diet, they can also transition again to a soft diet. In this diet, basically, we emphasize the patients to focus mainly on protein and as well as non-starchy vegetables. And finally, the least amount will be actually the carbohydrates. And finally, which is actually the last stages, when patients are tolerating with all the diets within 3 months, they can back to regular diet. But again, the regular diet itself still be managed by the dietitians, by myself, whereby I'll still do a meal plan for them, making sure I calculate the correct calories, portion size, and the types of the meals as well. So with all of these stages, basically, it's very full and it's a very like a hectic plan, I would say, because I think like every single week when patient came back, I have to create another meal plan, which is again can be quite a very full schedule for myself. But again, despite of this hectic schedule, always comes with um like wonderful moments, like a rewarding moments, and I just want to share a little bit more of that moments as well, and why I do like what I do in my clinics. So these are some of the rewarding moments as well. So the first picture here on the left, upper left corner here, is a picture of one of our most motivated patients. These patients was having the surgery, I think, about last year. And then within 6 months, the patient was able to lose about 100 pounds, which is pretty much about 45 kilograms within 6 months, which is, I think, a very huge or very significant weight loss there. And then just recently, within 1 year, the patients HbA1c, which is their blood glucose levels with range has gone down basically from 7.7% to 5.5%, which is like a remissions of the for diabetes. So basically, it really changed the whole person's life, and the patient was really thankful and was really happy and see that transformations. And I think this is where the outcomes of this experience, the outcomes of this care meet what made it the rewarding moment, because it really fulfilling moment, because you know that what you are doing basically really helps people and really change a person's life for like 180 degrees. And I think that's always being what I like about this job, because we can always track the progress and the outcome of these patients. And then aside from that, basically, of course, there's other opportunities as well in my departments. The picture right on the left corner here, this is me precepting another students. So this is actually again, another IMU alumni. This is Chua Chun Sui. She's also from DN116, and she joined Rutgers last year. And I was happy to be given the opportunity to able to become the preceptors, and I was able to train her as well in my clinics for about 4 weeks as well. And then she also currently just graduated from Rutgers as well, and she's doing really well. And yeah, and then aside from that, another rewarding moments is actually with my colleagues. I think because of this role is really play important role in dietitian as well. I think I was really receiving a lot of supports from my colleagues, and then really being appreciated of, and I think that's really rewarding for me, and I feel really fulfilled because all of them really show me supports and really reach out to me for any problems related to nutrition, basically. So really give me the sense of belonging to this department, basically. And then so the picture in the middle here is basically a picture of myself with one of our nurse as well, with one of our psychologists as well. So it's always fun, by the end of the day, even though you have a hectic schedule, to have a very fun colleagues. And definitely I will learn a lot from them, because every single day they will share something, one thing from their roles, basically, and really made me to be appreciative more about their different roles, and learn something new, basically, especially with handling new different patients, and of course learning more another aspect as well. And then it's always something fun, especially if you find something to improve on every single day, especially even if it's just like a 1% thing to improve on. It's still something that is actually worth it, and that's why this roles really fits me up to this day, because I always find something to improve on every single day, especially like in the picture on the right here. Um, one of our nurse basically, we always held like a workshop schedules basically every single month. And this is a workshop on placement of feeding tube placement on like a mannequin, and dietitians are very welcome to join and practice on placing a feeding tube for patients, including IV placement as well. So it's always fun, and we get to grow more as well as a dietitians, and as well as a healthcare professionals. And yeah, I think that's why I really love this job as well. I think these are the rewarding moments. There are more other moments, of course, that I want to share. Of course, there are more success story about the patients. I wish I could share more about more pictures about the patients, but in of course, in respecting patients' confidentiality, I couldn't share any more pictures. But yeah, these are the major moments from my careers ever since. I think to end these sessions or my presentations, my final message, especially for those who are aspiring to be dietitians, I think you guys have nothing to worry about, because dietitian career are very fast, meaning that it's very varied, it's very growing, expanding as well, like any other professions. Even in a clinical setting as well, you can be specialized in different areas, whether it's a renal dietitians, oncologists, bariatric nutrition support, even transplant as well. And the list will still goes on and on and on. And I think you will have no problem to find the careers that you will like, because I think my message just to be explore more. Don't be afraid to explore more. And I'm sure that you'll find one or more specialty areas that you are passionate about. And then as long as you're being consistent with things that you like and passionate about, I'm sure you'll find this job or career as a dietitian to be fulfilling and aspiring as well. And yeah, and think that's pretty much cover it. And if you, I'll just and this oh yeah, and thank you very much for this opportunity again for. And if you want to reach me out, you can also email me as well if you have any questions. But again, we also have a Q&A session as well. So yeah, I'll just stop here and pass back the mic to Dr. Khan.
Thank you, Dennis. That was a wonderful sharing. It's indeed a very proud moment for me as your lecturer to see how much you have grown in your career. Okay, yes, Dennis, you have a few questions, but we'll take it at the end after when you end speech. Okay, and it was very heart touching moment also when you mentioned that your patients become your friends. I think that's one of the rewarding things about being a dietitian. Yeah.
Exactly.
All right. Yeah. Thank you. So let me introduce to you our next speaker. All right. Also, I'm very proud to say she is IMU alumni from DN 117. So Miss Kong Wen Yuan, she is the Assistant Manager of Operation and Business Development and a consultant dietitian. She graduated with a degree of Dietetics in Nutrition from IMU University back in 2021. And upon graduation, she was recruited by Beacon Premier Wellness as a consultant dietitian. So, as for now, she has consulted more than 1,000 patients with various issues such as diabetes, cancer, hypertension, and hyperlipidemia patients. Her interest is particularly to empower people about healthy eating and how to manage their diseases. Wenyan is also our IMU preceptor. So without further ado, I'd like to pass the mic to Wenyan. Wenyan, all yours.
Okay, wait a moment. I will share my screen. Everyone can see my screen?
Yes, Wenyan.
Okay, okay. So thank you, Dr. Tani, Dennis, and I'm you to invite me to today sharing. So hi everyone. So let me introduce myself. Okay, so my name is Kong Wen Yuan. I'm an assistant manager of operation and business developments and community dietitians of Beacon Premier Wellness. And I also a certified HRDC trainer. And I also upgrade myself to take a diploma courses of nutrigenomic for professional of nutrition. This link back to what I'm doing, consulting nutrigenomic reports currently. And I'm alumni of the N117. So I'm dedicated to foster nutrition, health, and personalized well-being within the community. So let me share what I'm doing and my journey as a dietitian. So as a journey of becoming a dietitian, we can also be described as our career progressions. This is the first stage I will share with everyone that we must go through, become a student and also a novice stage. During this stage, it is crucial to learn and gain as much knowledge and experience as possible. So I can say that as a student in IMU, and then there is a few things that I can learn. Okay, so as a student in IMU, I would say there is a few things that we learn in IMU to prepare us to the real world, the real working life. And then this is the few things that I would say that IMU have prepared us quite well, which is the comprehensive educations. So as our journey as dietitian, I would say the foundation and the knowledge is very important. As now, as a preceptor of IMU Junior also, this I would say is a very foundations for them. They need to learn the nutrition, anatomy, biochemistry, physiology, and so on. The extensive course work is equip them with or equip us to the theoretical understanding to help us in our future practice as a dietitians. So we will learn the MNT and the nutrition, all those in our university. And also after we take all the theoretical knowledge already, then we need to go through the practical and internship experience. So for the internship experience and the practical experience, we will transition from the theory to practice. So during the internship, we gain the invaluable hands-on experience in variety of settings. So like hospital, community, and food service. This practical experience allows us to apply our knowledge in a real-world scenario. So this will enhance our skill in patients' communication, dietary assessment, personalized nutrition planning, working along with experienced professional like doctor, nurses, and healthcare professional. So we will learn to manage diverse dietary needed effectively. And also have the chance of the research opportunity. So research opportunity here engage in analytical thinking and critical research. So we will conduct like study, collecting data and analyzing result. And not only this to refine our skill, but also keep us up to inform about the latest advancements in the nutritional science. So the research project emphasize the importance of the evidence-based practice. So ensure our clinical decisions are well-informed and up-to-date. So this is like let us know that research is very important. So every time from now time to time, we also need to go through the latest research paper to know that the latest advancements, then only we can give our patients and our clients the up-to-date informations. And also I will say the mentorship and the guidance is very important also. It's a crucial role in our development because under the guidance of our lecturer, CI and preceptor, we will receive regular evaluation and feedback. So help us to identify our strength and area to improve. So our mentor, so like sometime for me, I will go back to find some lecture and Prof. We need to get some guidance or get some advice on what we are facing any problem or any thing that we need advice because they will share their experience and also some wisdom that provide us the insightful that help us to get some ideas on how we need to do or how we need to handle the situations. And also I say the important will be the extracurricular activity because the co-curricular activity is beyond the education and clinical setting, then it will significantly contribute to our growth. So for the event that we participants on the project and the public awareness campaigns, it will help us to develop our essential skills such as communications, critical thinking, and those activities require us to plan, organize, delegate the task, and anticipate a potential challenge. So this will help us to gain some teamwork and leadership that is help in our future working. So I will say IMU prepare all of these those for us. And then here is some picture that I would like to share that what we do at IMU that I think is very important for what we will gain experience and knowledge, like the food culture day, and then also food service management project. This is like we need to go and plan and we go and do the marketing survey and do some promotions. And also we have the community nutrition project and also nutrition in health and promotion project. This project we need to do the organization plan, prepare the education material, and then arrange all the back end work. And then we to arrange within the teamwork, we to work together with the team to make those projects successful. So I would say that this all will make let us learn a lot along the way when we are as adult students. And then after we finish our students, then we will start graduate. So after we graduate, we will start our stage 2, which is advanced beginner stage. So at this stage, we embark on our professional journey. So we're ready to apply our 4 years of extensive knowledge. This is a transition, is both exciting and challenging for me. So as we step into the real world setting, we are not longer have the guidance or like spoon-feed movements by our lecturer. So we need to depends on ourselves, on what we are learned to change the theoretical learning into the practical applications. So in this stage, we begin to recognize and understand the meaningful components of various situations. Although we are still building out in that experience, we have the foundation knowledge and the essential skill to start making the significant contributions. We navigate through different scenarios, and on the time to time, we start to gain confidence and competency to start to apply our knowledge into the real world settings. Okay, so my journey as a community dietitian began as Beacon Premium Wellness. So this marked the start of my career progressions. So let me give everyone a brief introduction of Beacon Premium Wellness, because what my opportunity and what my perks will happen is in Beacon Premium Wellness. So Beacon Premium Wellness is a pioneering startup company. It composed of a team of medical nutrition experts dedicated to precision nutrition. So our mission is to provide first-line medical treatments and personalized therapy tailored to unique needs of each individual. And until now, we are consulted more than 10,000 patients and clients with our different setting of consultations. And then our mission and visions of Beacon Premium Wellness, I will say, is resonate deeply with my own goal as a dietitian, because our mission is one to empower medical nutrition therapy and lifestyle interventions to community health. And our vision is the bridge and lifestyle advice gap between doctor and patient and to patients. And this brings health benefit to the consumer as well. Therefore, I will say in this Beacon Premium Wellness, I'm able to learn and involve in different setting and project is because of our Beacon ecosystem. So our founders would like to bring one-stop solutions to the community. So here is just a part that I show in this picture. It's just a part of the ecosystem that my company, Beacon Premium Wellness, work closely with. So you can see here we have Beacon Premium Wellness. I will share what our service in the next slide. Then you can see here have Premium Pure. So Premium Pure is a company that's selling functional beverage that might help in cholesterol management, cancer prevention, and skin wound recover. Also, those products also as one of our dietary tool for us as a dietitians to recommend to our clients because of the convenient solutions. And we have Beacon Precision Diagnostic Lab. There is a hospital-based lab that consists of core lab and molecular lab to serve patients and community with blood tests and DNA, which is pharmacogenomic and nutrigenomic. So what our role in this lab is, we as a dietitians, we help to analyze, which is we will explain the medical reports to our clients and community, and also the nutrigenomic report as well. Then we have Beacon Mart. Beacon Mart is a healthy mart chain that's selling high quality food and healthy daily food selections. So as a dietitian, we at Beacon Mart, what is our role is we will give some advice to our clients on what food to select, or based on their disease or their needs, then we will give some advice as well. And later I will share some photo that what we do at those places. And we have TCM also, traditional medicines. Their service will be like acupuncture, guasa, cupping, and so on. And we also have Beacon Resort. Beacon Resort is a retreat and a relaxed resort, as we also will run some our service, company service like HRDC training program in the resort as well. And we also in partner with hospital, university, F&B company, corporates, mart and resort as well. Then here is some the main service that my company providing, as also one of my job scope, which is we have medical nutrition therapy. This is our service, which is we will provide consultations. Then we have a HRDC claimable program, which is a training program. Then we have DNA profiling. So this is more to nutrigenomic and pharmacogenomic. So for this DNA, we will after client do the DNA test, we will discover their personalized nutrition and lifestyle recommendations. So we will through this their reports, then we will explain to them what their needs or what they are lacking of. Then on there, then we will pass our consultations along. We will tag along with them 1 month or 3 months to help them to change their lifestyle and help them to get improved in their health as well. And also we have a health and wellness workshop that we do for community and corporate side. And we have other service also. So we have wide range of service. So we have lifestyle and nutrition assessment, functional foods education service, nutrition course provider, and then cancer care as well, F&B collaboration and partnership. So we have healing diet and recipe, which is this, our dietitians will modify and create recipe. Then we will post on social media, share with our follower. Then we have internship program and international health program as well. So all these service that bring me to my working journey. So here are some picture of our working journey in Become Wellness. So one of it is dietitian consultations. So we provide one-to-one consultation to customer based on their medical reports and also their nutritional needs. So for myself, I already consulted more than thousands of patients. And for me, I hit a lot of people say, because I hear a lot from my friends or like colleague, they say that in their past working experience, they consult like the patient is 1 day around 1 or 2 only. We will say community side, like we don't say clinical side. So when community side, we get patients is very less, like especially if I'm working in pharmacy or those outside wellness center. But how we can get thousands of patients within, I think myself get thousands of patients within 1 year plus, is because that we are working together with our affiliates. So last time we are do CSR program at Become Map. So 1 day we are giving 50 to 100 of patients with the free blood test reports. And then we will do the consultations after the report is out. Then we will based on that, then we will give advice on based on their medical report, and we will tell them what they need to do or any lifestyle changes they need to do in here. So in this, we will get improved on our consultations and get more better. Then we can get well with our patients. And we also have health talk and webinar. So we will have 1 to 2 times per month. We will go to a company site or community site to have health talk and webinar. Then we also have a social media outreach, which is we have the chance to connect with a KOL to do some social media to share some health tips and introduce a healthy food to the community with social media. Then we also have the chance to set up wellness booth on community or some associations to share some healthy tips and do some body composition analysis or BP chat with them. I also have chance to join the Become Mart launching. So this is a new experience for us to like handling launching events. Then we need to have a very good communication with Become Mart team to make this opening successful. And we need to plan and set up and do all the activity in Become Mart. Then we also, during the Become Mart launching, we have the educations on the community on functional food and do some simple assessment as well to check on their BP, blood glucose, and also body composition analysis, and do some simple consultation with them. And we also will go to spa and wellness centers to consult the health talk and activity. This is when we go for wellness center, we need to modify our health talk topic, because when we go for spa and wellness, those community that go there is aim for relax. So the health talk topic and the activity we did with them is more to like relaxations. And we also have chance to conduct HRDC training at company site or beacon resorts. So we have those that we will conduct 1 day, 7 hours training, and also some outdoor activity like jungle trekking or team building as well. And also have chance to do some F&B collaborations, like we go to set up booth to do some cooking demo on healthy recipe that we created, and we will give some food tasting to the participant as well. So we also have time to time, like 1 month once, to do some video shooting on like the food or the food and the recipe that we created. Then we will shoot and post on social media, we share with our follower. And this is another event that we join that is more than 100 of participants that we conduct a health talk, and also the food recipe, which is like we do cooking together, we prepare food together and eat together. And this is we also join some corporates and community wellness booth, which is we will do some booth on mall or do on associations to promote our service, and also conduct some health talk, and also do some assessment with them as well. And we also have the service, or we also have do a awareness booth, which is the awareness booth. We are not only to community and our clients, we also sometimes we will do with a healthcare professional, which is this event is with APHM and MASO. Then we will introduce them the pharmacogenomic and nutrigenomic, as this is a new technology or new DNA test in the market, is quite new in Malaysia. So we not only want to share with our clients, we also want to share with the doctors or healthcare professionals, because we also want to bridge the gap between doctors and our clients. And I would say the perks and opportunity I have is as a preceptor of our IMU junior, because this is the first batch junior that joined us. Then along this preceptor life, I will say that we need to guide our juniors to the real world setting. We expose them as much as possible as dietitians, dietitians to the real world, how they need to prepare themselves when they start working. And then also like we will bring them to events. Then what activity that we having, we will bring them along. Then they can gain experience from them, and we will guide them along. And this is the next few batches that join us. So until now, we 3 years, we already accept 28 IMU juniors that join us as internship. All right. So our summary here is as a journey as a dietitians, we will go through different stages. So as a students, we need to go through 4 years of degree. Then we have to go through the fresh graduate challenge. Is like we need to do ourselves, and then we need to change our theoretical into practice, and we need to learn along. Then after that, we will learn the knowledge. Then we will be competence, experience. Then we will proficients and experts. So I will say this behind these 3 stages is as a working experience. Along the working experience, we will learn and we will gain the knowledge. So I will say that this 5 stage not only apply on a journey as a dietitian, it's also applied to everyone, every professions, and also every project or any positions that we are taking up. As we learn along, I will say never stop learning, because learning journey is every stage we need to learn. And I want to summary here is what my experience as if you want to become successful in our career and progressions and the pathway, we need to willing to learn. We need to have a teamwork, dedications, and then self-sufficiency, pressure tolerate, and technology serving, time management, project management, creative and innovative, because all these will link together to make us successful. So enjoy the journey as become a dietitians, and we need to open mind to accept any guidance and guide from our senior, and our superior as well. So thank you, everyone.
Okay, thank you, Yan. Again, a proud moment for me, listening to you, achieving a lot. You have seen more than 1,000 patients, yeah? All right, throughout your short career span only, actually, within 2 to 3 years. So very happy to hear that. And I love your Star Wars analogy. All right. Okay, so we have come to question and answer session. So I can see that we have a few questions, and let me take one by one question. So the first question is actually for Denise. So Denise, our attendee mentioned that, thank you for sharing, but may I know how was the learning or practice experience different in US compared to when you were in Malaysia? And whether you had any challenges, Denise, while adapting to the culture there?
Right. So I think that's a very good question. In terms of the experience itself, there are similarity and difference as well. I think if I cover the similarity first, is that in terms of the degree or graduates program at Rutgers, I think I have quite similar experience in Malaysia, because I think in IMU as well, we are being exposed with like problem-based learning, basically whereby students are the ones leading the classes. And then we also had a lot of um, clinical experience, especially like workshops at the CSSC as well, whereby we actually perform English and physical examinations. And I think that we were being covered a lot in Rutgers as well. So that's why I think it's not a surprise there. But I think the only thing that is a huge difference is, like um, like you mentioned here, basically is the culture. The culture is pretty much different in Malaysia and there as well. But in terms of the culture, I think it's more like have to be again self-sufficient. That you have to really be on your own basically, and then you cannot be relying on anyone basically, because you have to be on your own individuals there. But I have not really have a lot of challenges there, because I think the persons or the people there are pretty much very open-minded, and then pretty much very welcoming as well. So in terms of the culture wise, I think I have no problem with that. So I think, but pretty much in terms of practice experience, of course, you get different experience, especially in terms of like the cases that you're seeing in the hospitals. It's pretty much like a different population that you'll be seeing between Malaysia and United States.
Thanks, Dennis. All right. So glad to know that adapting to the culture is not a very big issue. Yeah, and we do find similarities when you saw patients in Malaysia and also when you saw patients in the US, I guess. All right. Okay. So thank you for that. Now, the next question for you is, why did you decide to study masters in US? Any reasons besides the Rutgers being our IMU partner school?
So I decided, so I think ever since I pursue my bachelor degree, I think I always wanted to have like a master degree program, but I still do not know what kind of master degree program back then. And then in my final year, I think one of our senior lecturer, Dr. Chen, was actually giving like presentations that with Rutgers as well, and explore more on that options that Rutgers master program actually provide more like clinical nutritions, which is like the pathway that I want to pursue more or be in the field of. So that's why I think that's one of the reasons I decided to pursue the master program, and that was actually before my graduations. And then so I was still in contact with IMU, so it was easy for me to apply there because I have my lecturers to support me with my letter of recommendations and other documents as well that I need. And I think the other question is there any other
Yeah, any other reason
reasons?
to actually do your master's in US besides Rutgers being IMU University's partner school?
Yeah, I think pretty much just the one domain reasons. I did explore a different master program as well, but I think so far only Rutgers is the pathway that I'm interested in because I searched the curriculum and the training that is being explored, which is pretty much covering clinical nutrition. So that's why I think that's the main reasons, because it fits to my passions.
Yeah, thank you, Danny. So Rutgers University being IMU University's partner university, so the students get exposure about what it's about and the support they need to do masters in US. All right. Okay. Thank you. So another question also for Dennis. The person mentioned that you sound very passionate about your career. How did you decide to start your career in dietetics? And Yuan, I'll be asking you the same question after this.
Okay. Again, another good questions. I think when I decide my career as a dietitian is pretty much I only know about that when I started with my dietetic practicum at IMU, because I think during the 3 years with learning about the curriculum, I'm still not sure yet what kind of field that I want to explore more as a dietitian. But then with the dietetic curriculum, a dietetic practicum, which is like a supervised practice-based dietitians in real life practice, you are being explored into different settings like the community, food service, and as well as clinicals. And then that's when I know that, oh, I'm in love with the clinical nutrition in terms of like healthcare services, providing nutrition services in the inpatient units or outpatient units as well. So that's why I decided to pursue clinical nutrition as the field that I want to pursue on. And that's why I choose my first career here in Indonesia as an inpatient dietitian.
Thanks, Dennis. Okay, Wenyan, how about you? How did you actually decide that dietetics is your career?
I would say that because as healthcare, because as I small that time I already like think to I want to go for healthcare pathway. And then as a doctor, I would think that I need to see the ill patients. And then after like I go through IMU as a foundation in science, then I found out that dietitians, this pathway, we are not only like facing ill patients, we are can doing some preventions, especially the community that have some there's not say illness, they have some the symptom here and there, then we can help them to improve through lifestyle interventions, and we change their diets. All this they can get improved in health and they will get well. So that's why for here I will choose rather go for clinical dietitian, because like clinical dietitian is like we need to face some ill patients or sick patients, and then community side is much more different. We will do preventions and we will see them will get well soon also. Yeah, that's why my journey I choose community dietitians.
Thanks, Wenyan. Yes, in terms of the differences in community dietitian and clinical nutrition dietitian, you have actually put the differences very well. Okay, thank you. So the next question is actually, how would you describe the job of dietitian as being repetitive, because you are going to see patients with the same illnesses throughout? So I will pose the question to Dennis first.
Okay, I think this question really depends on which specialty area that you're working on. Especially if you are an inpatient dietitians in a hospital, definitely you will see a different cases every single day, because if you're covering like different units, of course you'll be seeing patients with different medical problem, chronic illnesses as well, even in the surgical ICU cases as well. But in my cases, for example, like bariatric surgery, bariatric surgery clinics, of course, yes, you pretty much will be focused on main aspect basically, but it's not really that repetitive because every single day you're always meeting different people or different patients, and meeting different patients comes with different challenges and different interesting. So it's not really repetitive, and you don't really get bored because you always find something that is interesting on every single day.
Yeah, thanks, Dennis. I think I agree with you. Being a dietitian myself for over 20 years, the many patients I've seen, everyone has a new story and everyone has something new to teach me. All right. So it never gets boring. Would you agree with that, Yuan?
Yes, because like when we face different clients, although they have same illness or they have same symptom, but they are personalized and they are react to the consultation that you give or you the advice that will be different. They will react differently. They will give you different answer. Then they will have all those like different reactions when you are doing consultation with them.
Okay, thank you. All right, the next question is also for Yuan. What are the challenges that you feel that you face as a career as a community dietitian?
I would say the challenge that faced by me as a dietitian at a community dietitian is I think is different with clinical side, because clinical side those patients are illness, then they will follow like what we are consulting them or we are prescribed to them. For community side is a lot of challenge on they have different type of like they will tell you, I see from Facebook, I see from social media, I have a lot of things that tell me like, hey, this can help me, that can help me. The challenge for us is like we need to keep up to date to what they are facing with, or what the Facebook they will tell you like maybe eat this glass, it will help in my cholesterol, eat this, it will improve my diabetic. Then we need to go and keep update ourselves to go and research to find out that is it this really useful for our clients. So this is the challenge that I think that we need to keep us up to date lah, for what the new thing come to the social media or come to our clients.
Yes, and with nutrition is ever evolving fields. What is good for today is no more good for tomorrow. Yeah, so it's always a challenge to keep up, abreast with what is the latest things in nutrition. But I guess that's where lifelong learning comes, and that's where things never get boring for us dietitians. Okay, all right, thank you. There's a lot more questions, so I'm gonna pick and choose a few more questions. Starting salary. Okay, all right. So when how much are our fresh grad dietitians getting in Malaysia actually?
I would say different field we have difference, because I food service they have different, clinical has service different, community has difference. I would say that the minimum will be 2.5 to 3.
Okay, thank you, Yuan. Yeah, and in some industries they actually start with 3,000 ringgit over. So that's in Malaysia. Dennis, any figures for starting as a dietitian in US?
Starting salary, I would suggest usually if it's a bachelor degree, it's if it's like clinical dietitian, I'll guess usually it's about like 60 K per annual year.
Okay, all right. Okay, thank you, Dennis. All right. So now there's a question. Do you need to be talkative as a dietitian? Because we're constantly talking. I think they see three of us talking nonstop. So what's your take, Wenyan?
I would say that if based on different situations, some clients they need you to straightforward, but some clients they need to get advice that you must be talkative to them. That is a time to build rapport with them, because sometimes you become talkative, you will like not go straight to the point with them. Like when we do consultation, we need to like chit chat with them first to get some rapport with them. After that, only like they will open up with you with their disease, or open up with them with their issue. Then only like you can more targeted with them with your treatments. So I would say this depends.
Yes. But I guess no need to worry about being talkative, because a part of the IMU curriculum is that we actually teach you a lot of things about communication skill, how to talk to a patient, how to look at their facial, language, how to get people to be motivated. So don't worry too much if you don't really like talking. Become a dietitian and you'll start talking a lot more. Okay, all right. So another thing is, there's a question about whether Rutgers provides scholarship for IMU students. Dennis, could you weigh in on that, please?
Yes, there are a couple scholarship programs, but so far that I know is that it's not a full scholarship. It's just like a partial scholarship that you can apply for every single year. So you can actually apply before you're applying, and also you can actually apply again next year during when you're studying with the master degree program as well. But it's basically like a general scholarship, so it's not a full scholarship.
Okay, all right. Thank you. Thank you for that. Okay, Wenyan, there's another question about whether your current job involves product upselling in order to achieve sales target.
As Beacon Pure Wellness, what we are looking for dietitian is we did not have any upselling to target to like achieve the sales target lah. We is like more to educate our clients and patients on what is this product is good for you. It's up to you to select or not lah. We don't have any target sales for that.
Okay, all right. Thank you for that. Okay, there's one more question that I guess that always could answer is whether it's possible to be dietitian with a nutrition degree, and what is the major difference between dietitian and nutritionist? So probably I will give my thought a bit on this. For dietetics, you actually work in the area of curative, okay, and rehabilitative, meaning you're actually seeing people with conditions such as diabetes, hypertension, hyperlipidemia. So you're actually consulting people on managing their diet when they have these diseases. While nutritionists primarily works in the prevention area. They work with groups, populations that is healthy and do not have any medical condition. So this is the major difference between dietitians and nutritionists. But perhaps, Dennis, you want to mention a bit about the situation in US?
Yes, I think actually it's pretty much the same like what Dr. Kani mentioned is that there are two different things. But I think the only thing difference in the US that the nutrition degree itself is not eligible for like license for registration dietitian, so you cannot really provide like nutrition therapy for the patients. It is not allowed. But again, I think to answer the question as well, if you have nutrition degree, you can actually apply for one of the profession degree as well to become dietitians, and you have to go to like trainings to get the 1,000 credit hours, and you'll be able to eligible for the registration examination for registered dietitians.
Okay, thanks, Dennis. So you need the clinical attachment. You need to undergo the clinical attachment to actually become a dietitian. And part of the dietetics degree in IMU University, you actually undergo 40 weeks of clinical community and also field service training. Okay, all right. Two last questions, I would say. One is about, can we work in Singapore with IMU dietetics degree? So I'll answer that. Yes, you can work in Singapore. In fact, many of my students and our alumni are actually working in Singapore, Middle Eastern countries, Brunei, Indonesia, US, like Dennis. All right, so it is recognized, and you just need to. And oh yes, we have students working in Australia also. So no issues when you complete your IMU dietetics degree. You can work in these countries, provided you get registration, yeah, like what Dennis did with the respective countries. Okay, all right. So one last thing, maybe Wenyan can help me to answer this. What motivates you to become a dietitian?
I will say motivate me to choose as a dietitian is like dietitian, this pathway can help us to improve the community health. We will help them to improve their disease and improve their overall health. And then we will get them, see them smile again, be happy again with their recovery. This is the biggest happiness bring to us, I would say.
Thanks, Wenyan. How about Dennis? What motivates you to become a dietitian?
I think yeah, I concur with Yan as well. But this and I think just to add more is just that the motivation I think comes in when I just learned that chronic diseases and non-communicable diseases become more emergent nowadays, and I think one of the major root cause of this is actually poor eating habits, or which is where our roles become very important here. Which is why I think it's very motivating that as a dietitian we can really change the course of someone's life, as well as it's become very important professions in today's world.
Okay, thanks, Dennis. Yes, and one more question from Ms. Ranjani is whether biology is a mandatory program for the pathway program for dietetics in US. Well, the Rutgers University program, you need to complete an undergraduate degree in dietetics first, and then you apply to do masters in clinical nutrition. And in the chat, I've actually put in a link to look at what is our minimum entry requirement to do dietetics in IMU. Right. So I think we have answered all questions. Thank you to everyone for being with us for the past close 1 hour plus to look at the career of being a dietitian. So I would like to end by saying thank you very much to both our speakers. Thank you to Dennis joining us all the way from New Jersey, and thank you to Yuan too. All right, so we would like to thank all the attendees and have a good night. Bye-bye.